A feeling of impending doom. That's how the CDC director described her fears of yet another COVID surge if people across the country let their guard down.
Well, coronavirus cases are skyrocketing in some states. Here in Southern California, our numbers are heading down. But the worry is that could quickly change. And KCAL 9's Tom Wade is here live with what the CDC director said. And what's next, Tom?
Yeah, well, what she said was pretty hard to listen to, because can you imagine even going into another lockdown right now? But that's what we could go through. Experts here in the Southland say it's entirely possible if we don't follow the guidelines. The good news is, though, the vaccination rate continues to gain steam.
Big crowds like these at our local beaches over the weekend are making the nation's top medical experts nervous. And today, the CDC director made this emotional statement.
I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared.
Dr. Rochelle Walensky is concerned because of scenes like this in Florida a week ago. Spring breakers, partying, and now COVID cases are on the rise across the country.
I'm speaking today not necessarily as your CDC director, or not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer.
Nationally, cases are up more than 10%, with hospitalizations also on the rise. 43 states have allowed most or all businesses to reopen, and 17 do not have mask mandates at all. This, as much of Europe is seeing another spike, and doctors say Paris hospitals are about to hit catastrophic overload.
The trajectory of the pandemic in the United States looks similar to many other countries in Europe. I'm calling on our elected officials to sound the alarm. We must work together now to prevent a fourth surge.
New Jersey now seeing the nation's largest spike in cases per capita. Air travel is surging too. The latest numbers from the TSA show the weekend to be some of the busiest travel days since the pandemic began. Sunday, more than 1.5 million travelers were in U.S. airports, the highest traffic in more than a year.
I think we need to be monitoring the situation very carefully.
Dr. Anne Ramoyne is an infectious disease epidemiologist and professor at UCLA's Fielding School of Public Health.
It's very important to remember that this is a fluid situation, and this is a novel virus. We don't know exactly what's going to happen. Considering we are just had a record number of travelers, we are in the midst of spring break. We've seen populations mixing, and we have more contagious variants circulating when we still don't have herd immunity.
But there is some good news. A new CDC study of healthcare workers showing the Pfizer and Moderna vaccines are 90% effective over 2 doses and 80% effective after just 1. And the vaccines can reduce asymptomatic infections. President Biden making this announcement.
That is by April 19th, 3 weeks from today, 90% of adults, people over 18 and over, will be eligible to get vaccinated.
And made this plea to governors.
I'm reiterating my call for every governor, mayor, and local leader to maintain and reinstate the mask mandate.
Meanwhile, as the death toll nears 550,000, a stunning admission from President Trump's former pandemic coordinator.
There were about 100,000 deaths that came from that original surge. All of the rest of them, in my mind, could have been mitigated or decreased substantially.
And Tuesday, a World Health Organization report on the origins of the virus is expected to be made public. The Biden administration says it is reviewing it. And there are already questions about the WHO study, which was jointly produced with China. It's expected the study will say the virus was likely transmitted from animals to humans through the wet markets in Wuhan, China, and not leaked from a Chinese lab. Juan, back to you.
All right, Tom, thanks.